You had a breast augmentation and they're too far apart. What the hell happened? What are you gonna do? There are a lot of reasons why this can happen, and a lot of it depends on what type of breast augmentation you had and who you are as a person. So when you put breast implants in the body, there are a couple of different ways of doing it. At the core, the most important distinctions are they above the muscle or are they below the muscle? Now everyone's talking about subfascial. For all intents and purposes, that's above the muscle. So when you put implants in below the muscle, which is something that's done all the time and totally fine, you are limited in how close your breasts can be together by literally where your pectoralis major muscle inserts onto the sternum or breastbone. That's it. The pec muscle goes in here, it inserts onto the sternum at some place. In some people, it comes together very close. In some people, it's super far. So if you're putting in implants underneath the muscle, you've got to know, and you should talk to your surgeon about, hey, where do the pec muscles go in, to give you a better sense of where those implants are going to be. Your breasts need to have some degree of separation, especially when you're in the nude. Because there are some people who come and they're like, I want cleavage, I want cleavage, I want cleavage. Listen, I've even seen some surgeons, I can't believe this. They literally make these breasts just stuck together, and it doesn't look right. Then you start talking about putting implants in above the muscle. So when your implants go in above your pec muscle, you are less constrained by some muscle holding things back and actually even pushing things down. At that point, you're mostly limited by where your surgeon goes and how close he or she puts them together. Now, there are some natural ligaments in the body, and this is something you see a lot of now that we're talking about things like preservé. We'll talk about that later. We're respecting the body's natural boundaries of ligaments to put the breast together, but the reality is if you want them close together, or if you want to really modify where the breast implants go together, above the muscle allows you to bring them in and out pretty much to wherever you want based on how you want them to be. Now, of course, a lot of that has to do with the size of implants, the projection, your tissues, how loose you are, all that other stuff. But at its core, that's kind of a thing you should always think about when you're thinking about how close your breast implants are or are not.